Welcome to the Two Rivers Public Health Department Clinical Call for January 2024. My name is Jackie Haley, and I am the Nursing Section Manager, and I get the pleasure of updating you on trends within our district and important information that could be helpful for you and our clients. Today, we will cover an array of topics, which include the TRPHD VFA program, information on RSV, influenza, and COVID, HANA updates, January's awareness on cervical cancer and blood donations, TB reporting, information on our new family support program, and our updated event calendar. Two Rivers Public Health Department has 7 counties: Buffalo, Dawson, Phelps, Kearney, Harlan, Franklin, and Gosper, for a grand total of 4,624 square miles. Here are Two Rivers' mission and vision. In summation, healthier communities for all. This slide introduces you to our nursing team. We have 5 community health nurses, which are RNs, and 2 program nurses, which are LPNs, and 1 billing specialist. Two Rivers has obtained a new vaccine program called Vaccines for Adults, or VFA. This program was formerly known as AIP, or Adult Immunization Program. The VFA program is federally funded to give vaccinations for 19-year-old and older that are uninsured or underinsured. The vaccines that are available are hepatitis A, hepatitis B, HPV, meningococcal ACWY, meningococcal B, MMR, pneumococcal 20 and 23, shingles, Tdap, varicella, COVID-19, and influenza. The VFA program is important because 8.4% of American adults are uninsured. Healthcare sharing plans are becoming popular, and many do not cover vaccines. This is considered underinsured. Many adults fall behind on vaccinations after they turn 18. And also, immigrants are required to receive certain vaccinations upon entry into the United States. Because of this program, Two Rivers is seeking to bridge the gap in vaccine needs. Two Rivers started Vaccines for Children program in 2020, and we were awarded the Vaccines for Adults program in July of 23. Two Rivers will carry most, if not all, private vaccines for those that are insured, and we will continue to offer vaccine clinics in office and out in the community. See our community calendar or call for more information. Now we will change gears and learn about respiratory syncytial virus, or RSV. RSV is a common respiratory virus that usually causes mild, cold-like symptoms. Most people recover in a week or 2, but RSV can be serious in infants, elderly, and those who are immunocompromised. Symptoms could be runny nose, decrease in appetite, cough, sneezing, fever, or wheezing. RSV labs so far this season in Nebraska total 3,959, and we've had less than 6 RSV deaths. RSV treatment and prevention is focused on supportive care. Antiviral medication is not routinely recommended. Most RSV infections resolve in a week or 2, and in severe cases, hospitalization may be required for supplemental oxygen, breathing support, and/or IV fluids for hydration. There are 3 different recommendations on RSV immunizations. There are 2 RSV vaccines that have been licensed by FDA and recommended by CDC for adults aged 60 and older using shared clinical decision making. One RSV vaccine has been licensed and recommended during weeks 32 through 36 of pregnancy. And then there's another RSV preventative antibody that has been licensed and recommended for infants and some young children. Each year in the United States, RSV leads to approximately 2.1 million outpatient, that's non-hospitalization visits among children younger than 5 years old, 58,000 to 80,000 hospitalizations among children younger than 5 years old, 60,000 to 160,000 hospitalizations among adults 65 years and older, 6,000 to 10,000 deaths among adults 65 years and older, and 100 to 300 deaths in children younger than 5 years old. FluView update for January 2024. Nebraska changed from minimal influenza activity to low activity. Most states changed from low and moderate activity to high influenza activity. The Two Rivers District is also seeing an increase in influenza. This slide shows the Two Rivers District influenza A/B and RSV trends for January 2024. The takeaway: influenza B and RSV are trending upward, and influenza A has had a slight decline. This slide shows the Nebraska influenza A, B, and RSV trends for January 2024. The takeaway: influenza A and B are trending up, and RSV is trending downward. In comparison to the Two Rivers data, Nebraska is faring a lot better as a whole. Next, we have COVID hospitalization data for Nebraska and the U.S. Nebraska's new hospital admissions for January were 226, and per 100,000 population, that equaled 11.68. Total hospital admissions since August of 2020 were 33,822. For the United States, COVID hospital admissions were at 34,798, and per 100,000 population, we're at 10.48. Health Alert Network posted a CDC health advisory on the need to increase immunization coverage for influenza, COVID, and RSV immunizations. This HON is alerting healthcare personnel to low vaccination rates, which could lead to more severe disease and an increased healthcare capacity strain. In addition, there has been an increase in cases of MIS-C following COVID infection in the United States. The table is showing influenza vaccine coverage estimates in the United States, comparing the influenza seasons of 22-23 and 23-24. So, what should providers take away from this HON? We should be administering influenza, COVID-19, and RSV immunizations now to patients, if recommended. Recommend antivirals to eligible patients, especially patients at high risk, and then counsel patients about testing and other preventative measures. The table is a handy at-a-glance vaccination conversation guide for healthcare providers. January is Cervical Cancer Awareness Month. We use this month to bring awareness to our communities about this preventable cancer. We know the cause of cervical cancer. It's human papillomavirus, or HPV. HPV is very common, but there is a safe and effective vaccine to protect against this virus that can be given to boys and girls before exposure. Two Rivers offers the HPV vaccination, and this vaccine is recommended for girls and boys ages 11 to 26. Here are some interesting facts about cervical cancer. Worldwide, annually, 528,000 women will be diagnosed and 266,000 women will die. Each year, 13,000 women in the United States will get cervical cancer and over 4,000 will die. Any kind of sexual contact transfers HPV, and 80% of sexually active men and women will get HPV. All women should begin cervical cancer screening starting at age 21. And the screening guidelines are as follows. Ages 21 to 29, you should get a Pap testing every 3 years. And ages 30 to 65, you should get an HPV and Pap testing every 5 years. And ages 25 plus, there's an option for HPV testing first with follow-up tests if needed. So remember, knowledge is power. And for more information about HPV and cervical cancer, visit www.survivor.org. January is also National Blood Donor Month. This aims to celebrate blood donors and remind people of the importance of donating blood. Winter months are often a time of reduced donations and increased risk for blood shortages. So, blood donation awareness aims to help ensure that blood donations are readily available to patients. Find a location near you and schedule your life-saving donation. Yearly, Two Rivers is asked what the TB incidence is for our Two Rivers district. Due to our low numbers under 5 cases per year, the Two River data is listed as an asterisk. For reporting, you will need to report 5 or less. I am unable to get a more precise number. National TB incidence rate for the United States in 2022 was 2.5 per 100,000 persons. I have included QR codes to the most recent MMWR on TB incidence and the DHHS annual TB report. Please let me know if you have any questions on this data. Two Rivers is growing. Two Rivers has a new program called the Family Support Program. This offers a research-based home visiting program, and their focus is to enhance child welfare, health, and development, promote child well-being, prevent child abuse and neglect through family-focused and empathetic support that they provide in the home. For more information, please contact Haley Eshelman at Two Rivers Health Department. If you have never visited the Two Rivers Public Health Department website, you should go and check us out. We have so much information online. And if you can't find the link for the monthly call, never fear, the link lives here. You can also look up our event calendar. Our event calendar will tell you where we will be within our district. If you would like to schedule an appointment for one of these clinic days, you can call 888-669-7154. And finally, if you have any questions, please email me, Jackie Haley, at jhaley@trphd.ne.gov. We would love to hear from you, whether you want more information or would like us to cover a specific topic.